Hi, good afternoon, everyone. This is Saro Arakelian, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and updates. So, what is ULTOMIRIS or ravulizumab? ULTOMIRIS is a medication used for mainly paroxysmal nocturnal hemoglobinuria or PNH or atypical hemolytic uremic syndrome or aHUS. So let's dive into the summary information about this drug. As far as the indications go, as I mentioned, ULTOMIRIS is a complement inhibitor indicated for the treatment of adults and pediatric patients 1 month of age and older with paroxysmal nocturnal hemoglobinuria or PNH. Also, it's for the treatment of adult and pediatric patients 1 month of age and older with atypical hemolytic uremic syndrome or aHUS to inhibit complement-mediated thrombotic microangiopathy. It's also for the treatment of adult patients with generalized myasthenia gravis or GMG who are anti-acetylcholine receptor antibody positive. And finally, it's for the treatment of adult patients with neuromyelitis optica spectrum disorders who are anti-aquaporin 4 antibody positive. So again, ULTOMIRIS is for paroxysmal nocturnal hemoglobinuria, atypical hemolytic uremic syndrome, generalized myasthenia gravis, and neuromyelitis optica spectrum disorder. As far as the dosage and administration goes, I highly recommend everyone to refer back to the package insert, which has the step-by-step directions and the dosing and the tables for the weight-based dosing of this medication for the various diseases indicated and also various patients. But as in summary, the recommended intravenous ULTOMIRIS loading and maintenance dosing in adult and pediatric patients 1 month of age and older, weighing 5 kg or greater, with PNH or aHUS, or in adult patients with GMG or NMOSD, weighing 40 kg or greater, is based on the patient's body weight, with maintenance doses administered every 4 to 8 weeks, starting 2 weeks after loading dose. The IV dosing schedule is allowed to occasionally vary within 7 days of the scheduled infusion day, except for the first maintenance dose of ULTOMIRIS, which is the important dose. But subsequent doses should be administered accordingly to the original schedule for the best benefit of ULTOMIRIS. The recommended intravenous ULTOMIRIS loading and maintenance dosing in adult and pediatric patients 1 month of age and older, as I mentioned, it's based on the patient's weight, and in the package insert comes in a specific directions on the dosing. And I've included a table of this dosing from the package insert for you to see over here based on the indication PNH or aHUS, aHUS or PNH, aHUS or GMG or NMOSD indications based on the patient's body weight. There's a loading dose specifically and a maintenance dose associated with each of them every 4 weeks, every 8 weeks, or every 8 weeks based on the patient's body weight and indication. So again, each vial of ULTOMIRIS is intended for single dose only. ULTOMIRIS vials are for intravenous administration by a healthcare provider and are intended for intravenous administration only, IV infusion. The vials should be diluted before usage. As far as dosage available, ULTOMIRIS comes in an injection format, obviously, 300 milligram per 3 ml, solution in a single dose vial, or 1100 milligram in 11 ml solution in a single dose vial. Contraindication wise, ULTOMIRIS is contraindicated for initiation in patients with unresolved serious Neisseria meningitis infections. So again, those patients, the ULTOMIRIS should be excluded, at least if unless the infection has been released, or the patient has been recovered from it. As far as the adverse effects goes, most common reactions to the adverse effects in patients with PNH were upper respiratory tract infections. Some patients may experience headache, vomiting, nausea, diarrhea, and some patients may experience backache, arthralgia, or urinary tract infections. Again, this is a summary information about the ULTOMIRIS or ravulizumab, which is a medication indicated for paroxysmal nocturnal hemoglobinuria, atypical hemolytic uremic syndrome, generalized myasthenia gravis, and neuromyelitis optica spectrum disorder. For more detailed information on this drug, refer back to the package insert, which will go over the side effects, cautions, precautions, and especially the dosing, which is specific per indication of the medication, and based on each specific indication and the patient's weight. There's a specific loading dose and maintenance dose that the package insert reviews and talks about. Hope you enjoyed this video. As always, stay safe and take your medications.